The topic of this podcast today is so you want to be a doctor. For you guys, once you got into medical school, at what point do you think you made the big, I call it the split between I want to be a medicine doctor or I want to be a surgeon? Because two totally different personalities. All right, everyone, welcome to my first podcast for the Dr. Morales Plastic Surgery YouTube channel. And we're getting the seasons for my first season started out right with my first podcast guest. And these two amazing human beings here are Dr. Bahar Abbassi, and this is Dr. Bryan Pyfer. And so the topic of this podcast today is so you want to be a doctor. And so I'm a plastic surgeon, as everybody knows, and those who don't know me, I'm a aesthetic board certified plastic surgeon. My specialty is aesthetic surgery. And my two colleagues here are also plastic surgeons, and they are learning their skills in aesthetic surgery. As we have an aesthetic fellowship program in our group practice, and so my two colleagues here are spending a year with us, kind of hone their skills in aesthetic cosmetic surgery, and they'll be soon on their way into private practice by themselves here within the next 6 months or so. But I wanted to bring them here with me today to kind of go over what it takes to be a doctor, because I feel like as societies continue to evolve with technology and how people interact in social media, I think the importance of education, I think, is going to be increasingly more valuable, and I think the field of medicine, needs more doctors. That's my personal opinion. So what I wanted to bring my colleagues here today to kind of talk about their experiences about choosing why they want to be a doctor, first of all, and then kind of the evolution of, I figured I want to be a doctor, and then we kind of go into, I wanted to be a plastic surgeon, like the evolution of that, really, basically. And so for me personally, it was an evolution since I was a kid. Those who follow me maybe know this, maybe don't, but my personal story is I was a very young kid who loved what his dad did. My dad was a medical sculptor at the Galveston Shrine. I think you guys know this already. And he was an artist, and so he made silicone prostheses for the burn children at the burn hospital. And he had, plastic surgeons work with my dad every day. They would come in his office and ask for these new prostheses we made for the burn children. And we need to do this, Roland, and it needs to do this, but we need to cover that. And so, I grew up in my dad's office during the summer, or whenever he would let me, I would go spend time with my dad. And, just being around my dad. And I was around plastic surgeons at a very, very young age. And so that was my inspiration of being, I wanted to be my dad. And I told my dad that I want to be you. But the plastic surgeons would tell me, you're going to be your dad and you'll be more. And so that kind of stuck with me. And that impression of what a doctor was, of taking care of children, helping them be functional, helping them have, better, aesthetic outcomes and functionality was really impactful for me. So for me, I was just kind of, laser focus on needing to be a doctor. And so it's an evolution of steps, as you guys know. And so I kind of want to hear your insight into how you got started in the interests of medicine, with evolution and going into being a doctor. What were the key inspirations for you? That to me, I think, is very, very inspiring for the younger generation, right? Who are watching, I get a lot of comments on my social media, like what I need to do, what should I be doing now in high school? I just had a college student with me yesterday, just watching me in surgery. That was a lot of fun. But the younger generation, I'm hoping to inspire. I think we need more physicians. It's an amazing specialty for what we do, as you guys know, and you've chosen as your profession. But there's, in the field of medicine, there's so many things to do, right? So many great specialties in medicine and surgery. And so I wanted to start off my first podcast with you guys because I find you guys personally very inspirational, and your stories are both amazing. These two probably the most impressive people I've ever met on paper and in person. Oh. That's the truth.
Wow, very nice of you.
So that is the honest truth. Wow. So
thank you.
I thank you again for coming. So
thanks for having us.
Bahar, so let's kind of start with you. What if you could say back when you first kind of thought about what am I going to do with the rest of my life, when did that trigger of saying, I think I want to be a doctor happen?
I want to first start off by saying what you just said about letting the student shadow you. That's a true testament of you and your personality and paying it forward for the betterment of all of our education. And that's something that not a lot of people know about Dr. Morales. He really cares about educating and inspiring and motivating people, and I love that. So thank you.
Welcome.
I really respect that, and you as a mentor. My inspiration to go into medical school, I always was interested in sciences. I actually wanted to be a veterinarian.
Really?
Yeah.
When did that start? Was that in high school?
Much younger.
Wow.
Much younger, like middle school. I really wanted to be a vet. I was very strong academically in the sciences. And then my father suffered a massive myocardial infarction, so he had a heart attack. And he actually passed, and they were able to resuscitate him and bring him back. Mm-hmm. So it was kind of at that pivotal moment that I shifted my focus from animal sciences to human sciences. And that was my main motivation for wanting to go into medical school.
Wow.
Is that I wanted to help others just like those medical providers saved my dad and our family.
Awesome. So I was in high school, right? Kind of high school-ish.
It was younger.
Younger.
But
Wow.
like middle school.
Okay.
But then by high school, I knew by that point that I was interested in pursuing medical school.
Yeah. Did you have anybody in the family was in medicine
No
at
one.
the time? No one. So
No
you're the
one.
first. Yeah, me too. I'm the first one.
No one.
First doctor in the family, and I think Bryan, same thing, right?
First doc, yeah. Yeah,
First
that's
doc.
it.
So what a cool thing in common, to be, your family looks up to you. You have, friends and family who don't really know anything about medicine, and then you're like, I want to be a doctor. Like, for me personally, I didn't really tell anybody that I want to be a plastic surgeon. To be honest, I didn't feel good enough or smart enough to do it. I was Hispanic and really an all-white community, and, I wasn't the smartest, I wasn't the brightest star. I think you guys know that. But I worked really hard. I knew what I wanted. I knew how to get there. It was just a lot of hard work. And so I didn't tell a lot of people. I didn't really brag about it. I just kept my head down and just kept grinding, I think for you it's kind of the same, right?
Yeah, I mean, my path to medicine is a little windy, I think, and I think I've told both y'all, but I grew up in Southern California in a fairly well-to-do community.
Mm-hmm.
When I was 9 years old, my dad is a small business owner, is a roofer. He lost his business, claimed bankruptcy. We lost our house. We lost pretty much everything.
Man.
And I had 5 siblings at the time. There's 6 of us. We were like starting over. I was 9, and I grew up roofing with him. He's a hard worker, and my mom's a hard worker, and they taught us real young to be industrious and to save and to earn and to do good in school. To do well in school. My dad's a kind of an Idaho farm boy type, a little bit old school, where he thinks that all your world's problems kind of go away if you, get straight A's and kind of make it to the top of your class and all that, which is not necessarily true, as we know. But it kind of put me on a path as a young kid to be a academic high achiever, and I think with that, there's some kind of cultural stigmata that, oh, you're good in math and science, you'd be a great doctor,
Right.
So even as a little kid, maybe 9 or 10 years old, I mean, that's like got kind of stuck in my head. I loved math, I loved science, I loved animals, I loved, the rat dissection day and the toad dissection day.
Yeah, me too,
and
I remember that.
a lot of the kids were like super squeamish and didn't want anything to do with it, and I was like the kid that was like jumping in there,
Yeah.
Get in there.
learning where the liver is and the heart and everything else.
Yeah.
I don't know. I think mixed, that with my propensity to work with my hands.
Mm-hmm.
I grew up roofing with them every summer. My kids, our friends would go to the beach, and I'd go to, some roof and work all day long on a roof. And I just love creating things, building things, working with my hands. So I think it all kind of came together in an interesting way, but that's...
I mean, you're a smart guy. I mean, you're multi-talented, different things. But when did it come to medicine? Like, is it just because you had the quality of the science and the math? Like, at what point were you like, I think doctors...
No, I think this goes back to like maybe my old school upbringing where, for me, I heard all the time, we can't afford that. It was job to job, paycheck to paycheck. In hindsight, now looking back as an adult, I mean, I always had everything we needed. As a kid, we never went without.
Right.
But, growing up in extreme wealth in a wealthy community in Southern California and being told all the time, we can't afford that, we don't have that, we don't need that. I just remember thinking, like, I'm not going to live like this.
Yeah.
And so I think there was some part of me that thought, I got to do something different. I don't want to grow up and be a roofer. I want to be paid well, but I want to do something that's meaningful. And so I don't know, maybe somewhere in middle school or high school that I did I start meeting enough people that talked or knew about medicine enough to say, yeah, I think a doctor, that's for me.
Cool. So kind of like high school, you kind of had an idea you want to go down the doctor path. And so, those of you who don't understand how the training and the education evolved, it can be quite lengthy, right? So once you decide you're going to be a doctor, I want to go to college, you go to college. Back then, like when we went to school, it was typically, historically, you want to do something kind of biology major. So like for me, I had a major in microbiology. Bryan, what'd you have?
Finance, actually.
Finance. That's right.
A little different, yeah.
Bahar?
Can you teach me something?
Yeah. Yeah.
I majored in biochemistry.
Yeah. It's usually some kind of science related
Yeah.
for physicians, but it's definitely kind of evolving to where there's multiple kind of undergraduates and degrees and stuff like that. But once those people who are watching me and watching this podcast, the idea is you get into college, and then usually around the sophomore, junior year, start thinking I need to take this freaking test. It's called the MCAT, and the MCAT is like the major gatekeeper examination in your career as a physician. That's one thing that maybe some people don't know is you're going to be tested repeatedly throughout your career to get to the point where you want to get to. And then once you're there, guess what? You're going to get tested even more. Mm-hmm. So the reality of it is that the MCAT is the first kind of gatekeeper. And, the better you do on it, the more doors that are open to you and opportunities to get into medical school. And so medical school training is going to be 4 years of medical school. There's I don't even know how many medical schools are in the United States. There's some in the Caribbean. You can, some are out of the country itself. That's a little bit harder to get into once you're out of the States. But medical school is going to be 4 years of your life. And what I found interesting when I went to medical school is that you get there, you feel like you're pretty smart because you got to medical school. And you get there and you're like, wow, everyone's freaking smart. Mm-hmm. A lot of people are smarter than me. And then it says a whole nother level of how hard you're working, right? And then just experience everything. It's such a great, cool I remember medical school is such a powerful transformation for me personally for the anatomy. Like the anatomy was just, to me, just phenomenal. Like I knew right then and there I was going to be a surgeon. No question, hands down, I knew exactly what I wanted to do. It just solidified it for me because I saw it. I saw it with my own eyes. So for you guys, once you got into medical school, at what point do you think you made the big, I call it the split between I want to be a medicine doctor or I want to be a surgeon? Because two totally different personalities, completely different personalities. So at what point do you guys make that transition, that change, or I guess the decision of I'm going to be a medicine doctor or I'm going to be a surgeon?
Oh, immediately. I spent so much time, and I can't stress the importance of this, spend time with surgeons, providers, primary care doctors, any specialty you can get your foot in the door with, shadow them before you go to medical school, because medical school happens so quickly and you really are only introduced to a handful of specialties. That's by what the academic people choose, and then sort of like a lottery. Yep. Like I remember that. Submit for an elective and you hope you get the elective of your choosing. Yeah. So you may not even see all the specialties. So I kind of had a lot of people I'm Iranian, and there was a lot of Iranian doctors in the Dallas-Fort Worth area. So I spent a lot of summers and scattered times during my undergraduate going and shadowing them to build up my CV just for additional medical exposure. Sure. And so by the time I got into medical school, I knew I wanted to be in the operating room. I'd already felt that emotion of being there, the calmness, just the intensity, the joy of being in the operating room. I felt it from day one. So when I got into medical school, I kind of had already made that distinction.
Bryan, how about you?
It was pretty early. I echo Bahar in that I think it's valuable to spend some time. I grew up mostly uninsured or underinsured. I never went to the doctor, didn't know any doctors. But once I got married, actually I got married pretty young, I knew that my wife's brother-in-law's brother was a doctor. And like Bahar said, I think it's so valuable to try to reach out, create your own opportunities, call people up, ask them if you can shadow them, spend some time with them. That's what I did with him, and he actually was the chief of staff at a small regional hospital. And so he invited me out to do an internship, 4 months long. It was in the middle of undergrad, so I deferred my enrollment, and he set me up to work, 3 weeks with a OBGYN, 3 weeks with an orthopedic surgeon,
nice,
with a pathologist, with a pain management anesthesiologist. Awesome. very similar to like a third year medical school experience, where you
Yeah.
go around and rotate, and they taught me how to scrub in and how to hold, retractors and do all that stuff. So,
That's awesome.
here I am, a college kid scrubbing into surgeries.
Crazy. That's awesome. What an experience.
It really was. I mean, it not only set me apart on my resume for medical school, but I think it solidified in my mind, like, oh, okay, I know nothing about medicine until now, and this is actually, cool, like I thought it would be,
Yeah.
But I think at that point, I spent a few weeks with a pathologist in a lab looking at slides, and it wasn't for me.
Yeah.
OBGYN, I loved like being with people in like a peak emotional state, like women delivering babies. That was really fun for me, but I loved
Catching babies.
Catching babies.
They're slippery.
It was a fun time. I mean, really a great time. But the operating room, I think just the culture, the environment of the OR, it spoke to me. It just meshed with my personality.
Yeah, I do feel like when you finally see kind of where you're going to be for the rest of your career, I think it's, to me, it was like a light bulb. Like, I just saw it. Like, my first time in the operating room was like, man, I get to do this every freaking day.
Yeah.
Mm-hmm.
Like, wow, this is going to be amazing. It's going to be so much fun. Like, to me, like, you guys are the same. We spend time in the OR, and we literally spend, 8-10 hours a day together.
Oh, and it goes
and it just goes like that because you're just having a great time. You're super focused. Like, there's obviously nothing misses that, but we're super focused, and you're just kind of creating. It's just this creativity of what we do in our specialty that I just really enjoy. So I think you guys can echo the same sentiment.
Absolutely.
So, going back to the topic of, we're trying to, inspire the new generation, consider medicine, because I think it's a great, great specialty and great career. If you were to kind of give, a young person advice who's, looking to have a career that they really enjoy and, hopefully not consider a job, they actually enjoy it, because I think we found our passions here. What would you advise them? What would be the one thing that you kind of tell them to do, or maybe try to avoid? Like, don't do this, right? What would you say?
Don't listen to naysayers.
Like that. That's a good one.
I don't know how many times I was told I wasn't good enough. You'll never get in. You can't be a surgeon and be a female. You can't get into plastics. It's too competitive. I mean, every step along the way, people are telling you can't do it, and you just have to shut them out. Focus on yourself. Take it one day at a time. It's really easy in today's society to get overwhelmed because so much pressure is put on our youth and so much more focus is on academics. And it's much harder to get in now than it was even when we applied. So it gets harder through the years. And if anyone makes you feel like you're not good enough, then that person doesn't deserve to be in your life. And then if that person is your mentor, academic guidance counselor, start calling up medical schools. Figure out, if you didn't get in, what was the weakness in your application. I mean, there's always ways around it if you want it bad enough. Yeah. Don't take no for an answer.
Love it. Persistence.
Yeah.
I would echo that 100%. Like, that's I had people tell me, no, I don't think so. Like, watch me.
Right.
That to me personally was fuel for me.
Absolutely.
Like, give it to me. I want you to tell me no. Tell me no. Please tell me no. Because
100%.
It just made me even more and more persistent and resilient to get it done. So.
And it makes you appreciate the achievements.
Very much so. You've
that
earned
much
it.
more.
Yeah, very much so.
Like, you don't take anything
what do you think,
for
Bryan?
granted.
Well, I think another thing is don't feel like there's one defined path to get to medicine. You're gonna.
Yeah.
Bunch of people give you advice. Some of it's solicited, some of it's very much unsolicited, and then you have your high school guidance counselor, and then your pre-med advisor in college, and and everybody kind of thinks they have the algorithm figured out, and it's not the same for everybody.
Yeah.
And so if you don't hit step one, just like all the other friends that you have that hit step one or step two along this path, and I'm not talking about the test step one. There's a test called step one. I'm talking about
not to be confused with
not to be confused with the test called step one, but the first step in our path to medicine. If it looks totally different, then that's okay, and you can still get there. As I said, I studied finance. I worked in consulting. I worked in sales. I built a sales team. I was doing door-to-door alarm sales for some number of years. Before
I'm not going to take no for an answer.
Yeah, before I decided to go to medical school. Once I got to medical school, I almost left medical school to work on a startup that I'd started before medical school. And, and then I decided to stay in medical school, and then I decided to finish medical school and then get an MBA, so I stayed longer, and so it looks very different for everybody,
Yeah, I think you brought up a really, really great point in that I think young people, and if I would give some advice, just try to get exposed to many different things as possible. Like, so, I had a college student with me yesterday, and she had an idea she wanted to be a doctor, and that's great, that's fantastic, but do you really know what it takes to be a doctor, right?
Mm-hmm.
How many times have you seen what we do? Because there's so many things that we do. Don't close your eyes. Hopefully, don't close your eyes too soon to other kind of specialties of whatever type of business or whatever.
I think a follow-up point to that, though, is that medicine is an evolving specialty, or an evolving career, and there's tons of different places to go within medicine. You've already mentioned medicine versus surgery, but even within that, I mean, there's group practices or solo practices or international medicine or low income kind of demographic, medicine or
telehealth medicine.
Telehealth medicine. I mean,
exploding.
very tech, heavy medicine versus very, labor intensive with your hands medicine. And so, I guess my advice would be go do some stuff. Go do the stuff you love. Be passionate and have hobbies and go travel and go study abroad or go, take a job for a little while if it's totally unrelated, but maybe
Totally agree.
Maybe somehow could be valuable one
Absolutely.
day. So when you get to medical school and you get into your field and you're practicing, you have skills beyond just an ability to take an exam.
100% agree. Could not agree more. I think just exposure and all that is definitely something valuable. Or you can get it better. So, well, I think hopefully my followers learned something from this, but the idea is just really to inspire others. I really take a lot of, I find it very rewarding to inspire others, to mentor people, mentor students. That's one of the reasons I enjoy this part of my career, is doing my aesthetic fellowship, because I feel I can, inspire you to totally pass it forward in the future, right? So when I see you, 3 or 4 years out, you're not only being super successful, which I know you guys can be, but you're going to be hopefully teaching others and maybe have students and residents and high school students, and just kind of showing like you're the best of the best, right? And I think you kind of owe it to society to kind of give back a little bit. Mm-hmm. So anyway, that's kind of how I feel about it, and I want to thank you guys again for tolerating me, even though I kind of made you do it.
Thanks for having us.
Thanks for having us. Yeah, it's been great.
But enjoyed the time with you guys as always, and thank you guys for following. Stay tuned for more.